Galumbeck Plastic Surgery. This is New Techniques in Cosmetic Surgery.
Dr. Galumbeck, the eyes are one area that tend to look tired first in a person's face, and eyelid surgery can certainly remedy that.
Well, eyelid surgery is a very popular technique in cosmetic surgery because not only does it make a very big difference, but it's very subtle in that people will say you look well rested, you look like you've come back from vacation, not you had your eyelids done, didn't you? You know, we don't certainly want to give someone a startled appearance, but in the same token, we want to address certain things that occur in the eyes that give that tired, older, aged look. And mainly what happens in eyelid surgery or in eyelids with age is that there's fat. There's fat in the upper eyelid and in the lower eyelid. And there's a band that holds that fat back. And with time, that band loosens up, the fat slides forward, it stretches out the skin, and in the upper eyelid you get hooding, in the lower eyelid you get bags and puffiness. And so the goal of eyelid surgery is to remove the extra fat, remove the extra skin, tighten up the eyelid to give it a better appearance and a more youthful, more well-rested appearance. The incisions are small. They're in the upper eyelid crease. They're right underneath the lower eyelid eyelashes for the lower eyelid. And so once they're healed, they're really invisible. Recovery is quick. Stitches only stay in for a couple of days. I've had people come in on a Saturday, have their eyelids done. They come in Monday morning, get their eyelid stitches out, put cover makeup on, and go back to work. So the recovery is very fast for eyelid surgery.
Wow, okay.
As far as age, you know, people always say, well, am I ready? Am I old enough? Am I too old? And it's not really an age thing with eyelid surgery. I've had women and men in their 20s come in and get eyelid surgery done because of puffiness. It's more heredity. That, you know, my parents have it, I've got it, I want to get rid of it. I would say though on average, the average age is somewhere to the mid to late 30s where people start to see changes in their eyelids. Now certainly I've done eyelid surgery on people in their late 70s, early 80s. But I would say average is probably 35 to 45 when people start noticing the changes. You know, women say I lose platform to put makeup on my upper eyelid. People say I'm always tired. Men, especially in business, come in and say, you know, it's very competitive out there, and I look older, I look more tired, and I want to get something done, but you know, I don't want to have an operated look. And so certainly it can make a huge difference having eyelid surgery done.
Okay, so men and women, you can take heed because this is a procedure for either of you.
And here's a picture. Let me just go into the first picture. This is a woman who we did eyelid surgery on, and you can see in her before picture that she's got hooding of her upper eyelid, and again that's caused by the fat that slides forward. The skin stretches out because it's very thin and supple. Same thing under the lower eyelid. She has some crinkling, so a little bit of puffiness, and so our goal is to remove the extra fat, remove the extra skin. And you can see in her after picture that her eyes are just overall, they're more awake. They look more open without being startled. And that's what most people notice is that you look well rested. But if you look closely, the differences are that hooding from the upper eyelids is gone.
Okay.
The puffiness, the crinkliness under the lower eyelids is gone as well. And that's the kind of result that you can get with eyelid surgery. Very standard, routine result.
Okay, so big difference with not a whole lot of work and not a whole lot of recovery. We're glad you could join us. Please join us again for the next edition of New Techniques in Cosmetic Surgery. I'm your host, Jan Callahan, along with board-certified plastic surgeon, Dr. Matthew Galumbeck. See you next time.